May is Mental Health Awareness Month, and the theme for 2022 is Back to Basics, chosen to shine a light on the importance of the foundational knowledge when it comes to mental health. Joining us now live to talk about some of those mental health basics is psychiatrist Dr. Sue Varma. Always nice to see you. Thanks for being here. So let's start with what are some signs that someone you love is battling with mental illness or depression or anxiety?
When you see that this person has been having a low mood and it doesn't go away, I would say for 2 weeks or more, and you see that their functioning has gone down, where they're sleeping more than usual, and they've lost weight or they have appetite changes, and they're saying that the things that they used to once enjoy, the things that used to give them pleasure, no longer do, or that they say that they're feeling a lot of anxiety and worry, which is understandable in these days, except if they find that these intrusive thoughts are really getting in the way of day-to-day functioning, so that they're not able to concentrate or focus, or that they're worried and panic and they aren't able to specifically put their finger on it.
So what do you do to help them then if you find out that they're struggling?
I would say, if the symptoms are not interfering with their day-to-day functioning, with their work, they're able to show up and they say, it's mild. Something that I always talk about are basic habits, and I call them the 4 M's of mental health: movement, mindfulness, mastery, and meaningful engagement. So exercising, access to daytime sunlight, connecting with loved ones, and taking a minute or two to do some deep breathing. And those are in mild cases. And if we can do that every single day, we can prevent a lot of the issues. However, a disorder means that there is an impairment. At that point, I would say, psychotherapy, talk therapy, specifically cognitive behavioral therapy, even one session can be extremely effective. Of course, people who have more impairment in functioning may need more sessions.
And, these conversations for the layman, for the average family, right, they can be uncomfortable, but they are really important. Why is sharing, our own stories and discussing sensitive topics like this so important?
It is so important in this day and age that we have established a level of trust, mutual vulnerability, emotional disclosure. We are in a loneliness crisis and a loneliness epidemic where people feel that they're not seen, they're not heard, nobody understands what they're going through. And when another person is sharing with you appropriately to say, I've been there, I've also had some tough times, and I was able to seek help, and counseling was very effective for me. I saw a therapist. It tells the other person it's okay for them to share and it's okay for them to get help.
And there are a lot of celebrities who have been coming out and being open about, their own struggles and getting help and mental health. It's become, I think, less stigmatized than it was in the past. But then we're also seeing celebrities like Naomi Judd, and they seem to have it all, and then they die of suicide, mental illness. So it shines a light on the issue, but does it also have the opposite effect of people looking at what they're doing, taking their own lives, and maybe getting ideas from it?
Now, that's such an interesting question. And, copycat suicide is a thing where we don't want to glamorize or romanticize the idea of suicide. And at the same time, what we really want to shine a light on is some of this idea of treatment-resistant depression, or a lot of times when people are experiencing depression and they've tried 2 or more medications for adequate time, for adequate dose, and they haven't gotten better. It says it's time to seek a second opinion consultation. It's time to move on to different type of medicine or intervention. And it's really important that we have a good history, that we have to be the best historians when we go into our doctor's office. We and our families have to be our best advocate to say, these are the medications I took, these are the dates that I took them, this is why this one worked, this is why this one didn't work, these were the side effects, this is what I like about it, this is what I don't like about it. Because a lot of times people will come into my office and they'll say, well, I tried something maybe for like a day or 2, I'm not exactly sure what happened, it was a long time ago, maybe I had a few side effects. So taking a good history allows a doctor to say, okay, well, this treatment didn't work, let me keep helping you. So for me, I would say, there is light at the end of the tunnel. There are so many available treatments that are effective, and not to give up hope. It's really important to not give up hope.
All right, Dr. Sue Varma, thank you. I'm sure someone watching this will take your advice and get something, glean something good from this. Thank you so much for joining us tonight.
My pleasure.
Thanks for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.